We're going to start the scan, so I need you to do a 5 and place it on the device, and then slide all the way.
The Patient Secure system is basically a biometrics registration system. Patient safety is our number one concern, and what this system allows us to do is scan a patient's palm so that this way there is a vascular print that is only particular to their identification, and so it is positively identifying that patient at time of registration. In our environment or in our community, as with a lot of communities, we may have multiple patients with the same name and potentially the same date of birth. So what Patient Secure does for us is positively identify that patient.
Go ahead and place your just over here.
So as an example, we may have a patient that comes in whose name is Carlos Martinez. When we look in our registration database, we may see that there are 20 Carlos Martinez's. So then we will ask the patient, well, what is your date of birth? And that, of course, would reduce the number of Carlos Martinez's, but let's say we end up having 3 Mr. Carlos Martinez's with the same date of birth. What Patient Secure does is narrow that 3 Carlos Martinez's with the same date of birth to that exact Carlos Martinez with that vascular recognition. But of course, in our environment as an emergency department and a level 1 trauma center in our region, the main benefit that we see for our patients that do come through the emergency department and our trauma center is if in fact they are enrolled in Patient Secure, when they come in for services, all we would need to do is to scan them into the system. If they've been enrolled, then again, the benefit, of course, is that they would all automatically come up as a positive identifier so that this way our nursing staff would already have access to their medical record. You know, we are the first in the region to deploy Patient Secure. There are other facilities nationwide that are using it at this time, but we're the first in the region.